So our last speaker today is for this session is George Rutherford, Professor of Epidemiology, Preventive Medicine, Pediatrics, and History at the University of California, San Francisco. And George's topic will be economic costs of cocci. George.
You notice that I'm not an economist, so despite what John thinks. And it's always tough to follow the two CDCs. We always refer to the California Department of Corrections as the other CDC when I was at the State Health Department. So I basically did a quick review of this, trying to call the literature for estimates. So the search terms were coccidioidomycosis or valley fever, but not rift. There are 200 articles on the cost of Rift Valley fever and 8 on the cost of valley fever. So I found 12 published articles, 3 were within the scope, and there was an additional report in the gray literature. The first is from Arizona by Grizzle and colleagues, which was, and you'll notice the fourth author here, which is the lifetime cost of care analysis based on cases reported in Arizona in 2019. As we said, there was a female predominance. It's a somewhat older group than in California. This is from a societal perspective, and the total that was estimated was $736 million for 10,359 cases. The direct medical costs were $671 million, and the indirect costs were $65 million. So the average cost was $64,800 per person in direct costs. This is reported cases. This is not all cases. This is reported cases, and $6,300 for indirect costs. And costs varied by degree of complication. Obviously, disseminated disease cost well over $1 million, but primary uncomplicated pneumonia cost $23,000 in direct costs of bargain. And this just shows you some of their data from this article. I would call your attention to the overall costs and the cost per person per lifetime. So these are lifetime costs given a disease that was reported in 2019. Wilson and colleagues had a similar exercise in California. This looked at lifetime cost of care analysis based on cases reported in California in 2017. The indirect costs were calculated somewhat differently than in the Arizona articles, which makes it somewhat less comparable, but the direct costs are stand. The total was $700 million for 7,466 cases. The total direct costs were $429 million, and the indirect costs were $271 million. The average cost per case was $57,413 in direct costs and $36,297 for indirect costs. And the costs varied by degree of complication, with the disseminated disease again being over $1 million, and primary uncomplicated pneumonia around $22,000. It's remarkably similar to the $23,000 in Arizona. And one of our so this just shows you they also did some breakdown by area. This is slipped as this was supposed to highlight Kern County, not Kings County, where you can look at the total costs in these different counties, with Kern County having which is where Bakersfield is, having the highest rates of almost a quarter of $250 billion. Yes, so that can't be $250 million. Okay. Then finally, Gail Sondermeyer, who has a different last name, Cooksey, right? Reported hospitalizations in California, costs for hospitalizations. So this doesn't have any outpatient care. They abstracted the length of stay and hospital charges. Again, this is not what was reimbursed. This was what was charged, always a little bit of a subtle difference. The median length of stay was 6 days. The total charges, so this was over a 12-year period, was $2.23 billion, and the average annual cost was $185 million. If you look at the average hospital charge per patient, it was $55,000, and the outlier was at over $6 million. And the charges increased from $73 million in 2000 to $308 million, that should say million, in 2011, and those were inflation adjusted. And interestingly, one of the things that I thought was really interesting about this is that they looked at who got billed for this. and 62% of this went to government payers. And you can see that here where 32% of charges went to private coverage, 62% went to government, and the others were a mix of workers' comp and self-pay. So you can see how this is an expensive disease. So if you take these three estimates of 55,000, 57,000, and 64,800, and if you take a midpoint between the Wilson and Grizzle estimates and multiply them by the cases reported, again, these are just reported cases, to CDC in 2019, the lifetime cost, direct medical costs associated with this cohort of cases would be $1.125 billion. Now, if we take that and multiply it by 33, as we heard today, it'll be closer to, say, $35–40 billion. So a substantial amount of money. So I'm happy to try and answer questions on this, but this was just meant to be a review of what was out there. Thanks very much.
Thank you, George.